That's a yeah, perfect segue because I wanted you to take us inside of your clinic and the way that you're practicing now. I wanted to talk to you about obesity, type 2 diabetes, fatty liver disease. You're an expert in that. And I think going into your clinic and taking us through like what it's like to be there will give us access to all of those things that we can talk about in this conversation and food addiction and hormones and all that kind of stuff. So, what was it like to step out of the traditional medical model to, realize that that's what you were doing, to be a doctor, to want to help people is, in the system that we have is about giving people pills and seeing people for, a few minutes a day. What was it like to transition into what you're doing now in your clinic?
Yeah, in the public system, because healthcare in Canada is public, right? So doctors are employed by the government. And so the government dictates how much we can charge. Well, we don't charge the patient, we charge the government. So how much we get paid per patient, per minute, or per consultation, whatever. And and that's it. We cannot do a little bit of public, a little bit of private. It's all public or it's all private, right? So I was public, like all the doctors, mainly the vast majority of us, we are public. And there was more and more and more pressure to reduce the length of the consultations. And of course, if you can take longer if you want, but half of it will be volunteer unpaid work. And at some point you have to pay the bills at the end of the month too, right? So at some point, it became obvious to me that there was no possibility to do any quality medicine in shorter and shorter and shorter time of, duration of consultations, because then you don't even have time to be in front of the human being in front of you to listen and to just acknowledge, their experience and what they've been through and their complaints and what is not working for them. If you just want to take the time to listen to them and just be present with them, already 10 minutes have gone, right? And I'm not anti-medication. That is important that I mention it. I'm not anti-drugs. Drugs, medication, there are one tool in the toolbox. There are other tools. There are lots of tools to help a patient, right? And so my complaint with Medicine 2.0 is that all we offer now seems to be medication most of the times for most patients. And we don't take the time to say, yes, there is medication, but there's, nutrition. What you eat has a huge impact. There's sleep. If you don't sleep, huge impact on your health, on your well-being, on your mental health and all that. How do you sleep? How have you been sleeping these days? Take the time to go through all their lifestyle habits. And there's also the option of not doing anything. There's an option to go natural products, supplements and stuff. There's options to go into surgery or whatever. There's lots of options, but more and more, the shorter the consultations are, the more likely the patients will exit the office with a prescription for a drug. And that is not necessarily what they need at this point. Maybe that is what they need, but maybe not. Maybe they need that pill and something else. But if the consultation is shorter and shorter, then we don't have time to do miracles in 10, 15 minutes, right? And usually people who consult nowadays, they don't have one issue. They don't have one problem they want to discuss with you. They have multiple problems. This is the new normal. Having multiple medical conditions and issues is the new normal. It's the average, right? It's what people have: diseases, chronic conditions, they have pain, they have fatigue, they have brain fog, right? So discussing just one issue in 10 minutes, it did not fit with me anymore. So that is the public system that I exited from. I took 2 years to go to Singapore with my family, and I did not practice medicine in Singapore. I just did all my billions of projects and read tons of books. That pile of books you have on your night table that you're
That one
like,
right there. Yeah.
yes, that you're like, oh, I need to read this. And then just when you think you're sort of managing that pile, somebody suggests a great book, you have to read this. So I got to read my pile, but it's a never ending pile. So I came back with a pile. But anyway, I got to do a lot of stuff. I got to train in food addiction. I got to do all kinds of things, which was great. But when I came back to Canada, it was clear to me that I could not go back into a public system that put so much pressure into volume, seeing a lot of patients in a day. The more you see patients in a day, the less time you spend with them, the more likely you are to prescribe them only a drug. and that's not necessarily what the patients need. So I'm like, I need to go private, which in Quebec, going private is a bit of a rebellious act, you know, because we have this concept that health should be free, should be available, should be accessible. People should not have to pay to go see a doctor. We have, this is in our culture, this is in our mentality. So going private, most people, I think that the doctors who do move to the private sector, they are motivated by money. I know it can seem like that from the outside. In Quebec, we have a love-hate relationship with money. Eh? We are from a really, really Catholic background where we used to think money was dirty. You know, it was better to be poor than you're a better God-fearing person if you're poor. So we have this weird relationship with money in Quebec. So going into the private sector for more money is not well looked upon, you know. But in my heart, I knew I wasn't making that move for money. I was making that move so that I could do quality medicine. And because I'm convinced that this is my mission and this is what I want to do, I don't care what people think. I don't care if they think that I moved to private because I want to make more money. I don't care. If you make more money doing something that makes you miserable, you're just a rich, miserable person. What's the point of that? You know, I don't know. I'd rather take out the money from the equation. You have to love what you do on a daily basis. You do, because life is short and because you're here for a special mission. Everyone is here for a mission, I believe. So my mission is to help people regain their health. So this is what I'm going to do. So yes, I migrated into private practice, and now I spend 1 hour, one full hour with every new patient that I see. And I see them if they want. I see them every 3-4 months for half an hour, and I follow up on them. I take them through a journey of transforming themselves where they do the work. I just help them. I counsel them. I suggest, and we work together to see what's the best strategy for that person. What's the best plan? What's the priority? And what can they do right now? What's within their power? How much time or mental margin? How much mental juice they have right now to go on that journey with me, and I accompany them. And you know what? Every day, I swear to you, every day that I go to work, when I finish at the end of the day, I feel like I've ran a marathon, and I feel I don't feel exhausted. I feel inspired. I feel energized. I go back home smiling, and I get home and I'm like, today I saw this patient, that patient, they had diabetes, they don't have it anymore. That patient, the other day I saw a lady, she lost 100 pounds. She started working again. She had stopped working, and she had stopped believing in her dream of one day becoming a mother because her body was so sick. And then we had this big conversation, and we created a plan and strategy for her, and then she disappeared. I did not see her for 1 year. And then she came back and she said, maybe you don't recognize me, doctor, but I'm your patient, and you saw me last year one time, and you told me what to do. I did it, and I lost 100 pounds. I started working again, and my periods came back, and now I dare to believe that maybe one day I'll be a mom.
Wow.
How can you not be happy at the end of your day when that is every day? This is every day. Every day for me, I have patients like that.
It's amazing.
It is.
It's just amazing. Yeah, I think back on my career and like personal training, doing nutrition coaching, you're giving the people these plans that never work. They just don't work for everybody. And
Yeah.
you and I are both huge fans of Dr. Jason Fung and his
Yes.
concept of like blaming the victim. That's what we would do. It'd just be like, oh, you weren't good enough at counting, you didn't
Mm.
confront your emotions enough, you didn't have the right portions or the right calories, whatever. And then you find this other world, and suddenly it like you have a hard time finding who this won't work for. It works for seemingly everybody. It's amazing. And the job satisfaction is so incredible. Like feeling like, you did something, you made a little bit of a difference, you helped somebody. It's incredible. So it's such an addictive feeling. And I completely understand why you get so wrapped up in it. That's fantastic. And I'm assuming your patient population coming to you, because it's private, they probably already know what you're doing.
Yes.
Is that by and large correct?
Yeah, that is correct. The patients who come to see me, they've read one of my 10 books, or they've heard my podcast, or the whatever. The most of them have known me, but more and more I get the husband, the wife, the daughter, the neighbor, the best friend, the colleague. Like the right now, I have 850 people on my waiting lists
Wow.
just by sort of word of mouth, because it works. It's not magic. It's physiological. It's logical, physiological. Give the body back what it needs, rebalance everything, and the body knows what to do to be healthy and to stay healthy. It just we've lost our way. We've lost
Yeah.
our way with the food that is not really food, that is sold to us, the lifestyle that we have, the stress that we have, the pollution, the nanoplastic, the contaminants, the endocrine disturbers, name it. We've lost our way as human beings. We tell people not to go under the sun, it's dangerous. So people never see the sun anymore, never touch the ground anymore, never exercise anymore. This is crazy. You just go back to what a human body needs. And yeah, and you let the body heal itself, and it works.